Hi, welcome to our program today. I'm Libby Kennard with Parkinson's Resources of Oregon. This program is on fall prevention. September is Fall Prevention Month. We're so glad to have you here today. Parkinson's Resources of Oregon is a small nonprofit, just a few staff covering the entire state and also Southwest Washington. We provide um, education, support, wellness, and advocacy services. And we are happy to have you here. Um, our presenter today is Jim Cole, and I'll let him introduce himself, but he is a trauma educator and has been at PeaceHealth for a long time. I've known him for a long time, so I'm thrilled to introduce you to him and listen to his program. So let's see if I can stop sharing. Here we go. Okay, I'll hand it over to you, Jim.
Great, thanks. Good morning, everyone. I'm not sure. Oh, here we go. Share. There we go. Can folks see what I'm sharing? Okay, great. So, uh, Parkinson's disease is near and dear to my heart because my father-in-law suffered from Parkinson's, and but he had a really full, productive life, and most of that is because he chose to modify his risks. Um, And it's something that we all need to do, right? When we're young and we fall down, we literally bounce back up and we're doing fine, right? But as we get older, our bodies don't bounce as much, and we know that gravity is no longer our friend. I always say gravity sucks. It's true, and it seems to be really stronger in our homes because that's the place where we have a tendency to fall. So here at our trauma center, we're a level two trauma center. We see in the Eugene Springfield area, over 40% of all of our trauma is from people falling. And that's mostly people falling at home, slipping, tripping kinds of falls. And so if we could actually make a difference for people um, so that we get to say hello this way and not have to say hello when you're lying on a stretcher. That's what I really prefer, right? I'm sure others do as well. So my background is as a critical care paramedic, flight paramedic, 911 paramedic, and so I have responded literally to thousands of people who have fallen during my career. And many of these things, people have in common as far as their risk factors go. So, we're part of a national effort to use research informed data to look and see what we can do to really help prevent falls amongst older adults and those even who aren't older adults but have a high risk of falling. And that includes certainly people with Parkinson's. So we use the best available science that's out there. And so what I'm going to be presenting today is just that. What are we able to do um, in reference to, keeping ourselves healthy? So we're going to talk and learn today about what it means to fall and what we can do to decrease our risks. So when we think of a fall, we always think of falling to the ground, but that's not necessarily the case. Falls could include falling into and onto or against something. So imagine, yourself falling into a countertop or a side table, right? You don't necessarily have to, fall to the ground, but generally, it's we lose balance or we somehow, kind of move downwards suddenly. and it's a huge health concern, right? So for 65 and older, we see almost a third of people annually fall. And this increases to 50% of all those 80 and older. And probably many of us in this webinar have ourselves experienced a fall or the fall of someone that we care about that has had, consequences. Maybe as simple as a bad bruise and some skin tear, all the way, to some disability. Um, we also know that if folks are in any kind of a longer term care, whether that be assisted living or skilled nursing, about half of those folks are going to fall every year. And we know that people that have fallen once are likely to fall again unless we look at the risk factors and do some modification of that. And so we're all here to talk about this because we realize that it's a problem. We know that it's growing. Many of us in the baby boomer and Gen X generations are in retirement or headed into retirement. Um, Especially the baby boomer generation has lots and lots of folks. And so we are an aging society. And as we get older and we also have longer lifespans, we live longer, but not necessarily healthier. And as a result, a fall can be fairly devastating to us. Um, Here in Oregon, our area in Lane County, down here in the Eugene Springfield area, um, has the highest amount of falls per capita. Second is up in the Portland area. And overall, the state of Oregon, we have a lot of falls here in comparison to other places in the country. Generally, it's going to be women that fall more than men, but with us men, when we fall, we have a tendency to do more damage to ourselves because we have a tendency to fall not only just kind of slipping and tripping, but we also still decide to get up on ladders and roofs and do all sorts of inappropriate things that, remember, God made teenagers for a reason because they can fall a couple feet off of a ladder without a problem, but we can't. And we also know that as we get older, we have more falls, and we also know that the severity of those falls increases as we get older. We also know that people are unwilling to talk about their falls. People are afraid to talk to family members because they're afraid that their family members are going to feel that they're not safe in their homes anymore or need to move. They don't talk with their physician because, again, they're afraid to let them know. They're afraid that somebody's going to take away the car keys or whatever. And this is a real problem because this fear of falling not only keeps us from having these potentially life-saving conversations, but it also isolates this as a problem. And because we're unwilling to talk about it, we are sometimes robbing ourselves of some of the solutions about what to do about it. So it's really important to know that it's okay to talk about this, especially with your healthcare provider. And the goal of your healthcare givers is to help you live a healthy, happy, independent life where you're at. We love to see people stay in their own homes, but we know that home maintenance that I used to do in my 30s is not the kind of home maintenance that I can do here, being almost 60 myself. And so um, we just have to be realistic about what this looks like. With great cost, we know it's billions of dollars are spent. Worse is the loss of independence, the loss of our ability to be autonomous and to live independently and all the things that we want to. And so, if we really want to have those things, then we need to continue to be safe and mobile in those places. So there's a website, which is the National Council on Aging, or ncoa.org, and they have this little online self-evaluation, and it looks at this question of, are you at risk for falling? And some of the greatest indicators are that you may have fallen sometime in the past year. Maybe you still feel a little bit steady on your feet, or simply that you're worried about falling. If you're worried about falling, that is the greatest risk of creating falls. And that is when we start to worry about falling, we start to do things differently. We start to walk differently. Imagine yourself knowing that you have ice outside your door and you're going to be walking outside your door. How do you walk knowing that you're at risk of falling on that ice or snow? You kind of, walk, more. We talk about walking like a penguin, right? We use large muscle groups. We take steps very carefully. We're very flat-footed. But when we start to walk differently, that puts us at risk because our brains are not used to that. Um, so just, take a moment, think of these things. If somebody wants to throw this into the chat as a link, that would be helpful. And, feel free to take this yourself and just kind of see where you're at. Um, there are some things we can't change about our risk factors, right? How old we are, maybe some of the age-related changes, like, difficulty with vision and hearing. Um, Once we've kind of accepted some kind of a chronic health condition, it's really hard to get rid of it. Um, and we also know if we have a severe illness or accident, we end up in a hospitalization. We also know that just kind of, we're just not as sharp as we used to be. And so these require us to have to be thinking about how do we kind of get some of that back. But it's important to know that falls are not an inevitable part of aging. We don't have to fall and be injured. We can do something about it. So we can get hearing and vision augmented glasses, hearing aids. We can work on regaining our gait, which is our ability to kind of walk, strength, balance issues, um, and the behavioral choices that we make, alcohol and other sometimes even prescription medications can greatly impair our ability to be safe on our feet. Having good shoes, using walking aids if necessary, and we'll be talking about all this. Having a risk-free home, getting the clutter up off the floor, and being careful of where we put down rugs, and then asking ourselves, do we sometimes just need somebody else to help us? So we have a cycle of falling, and it's a scary cycle because it's one of those cycles that just keeps feeding into itself, and as it does, it increases our risk of falling. And so, just again, this idea of that we're anxious or fearful of falling, we start to limit our activities, and as we start to limit our activities, it reduces our ability to safely move about. That increases our level of isolation. And with that, all of that makes us more depressed and decreases our physical capabilities. And as that happens, again, it increases our fear of falling, and we get into more self-isolation patterns, and we get into, being less active, and as a result, we kind of become, we're a self-fulfilling prophecy because we're afraid of it. We end up doing all sorts of things unintentionally that actually make us at increased risk of falling. So depression and anxiety increases our risk, right? So, and we know that because when I'm not feeling all that great or I'm feeling a little anxious, I have a tendency to do less than I normally would. But then that can also free fall into poor sleep and bad appetite, which ends up with nutritional deficiencies. Um, Medications that we use for anxiety and antidepressants, they will slow our movement and cognitive functions. It decreases our inattention, and it can be a spiral. That's not to say that we don't need our medication. We do need our medication, but we also just need to know that that medication in helping in one area could be detrimental to us in another. So this is where we have to be thinking about, do I have adequate nutrition? How is my sleeping? We all live here in the Pacific Northwest, and so we are all vitamin D deficient. And because we're vitamin D deficient, and that is really necessary for balance and muscle strength and cognitive functioning. So those things are really, really important. How do we start to really reduce our fall risk? We have to do it together. We have to include not only just our primary care provider, our doctor, nurse practitioner, whomever, But this is something that we need to take responsibility for ourselves because while our doctor might be able to say change our medications to something that still helps us with our blood pressure but doesn't cause us to be so dizzy, us choosing to follow through on how I'm staying active, being proactive about uh, vision and hearing, my intentional interaction with others, and my willingness to simply kind of get up and move on a daily basis, and being able to do that. But we need to do that in a safe environment. Most falls occur in and around the home, right? So the most dangerous place for us as older adults is in the home. And that's because we get comfortable with our home, right? We kind of know its foibles and tricks. And so, maybe that one step that's a little wobbly, we look out for that step. Um, how do we start to think about our home? We need to actually assess our home. And so you can Google multiple things. Just go on Google and look for home safety checklist. And there's a bunch of them out there. The AARP has a great resource for that. And it just kind of brings you through different areas of your home, looking at, do you need to get rid of clutter? How's the lighting? Do you have, sturdy handrails? Do you maybe need some kind of an assistance bar to help you get in and out of the tub? Um, all these kinds of things are really helpful. But tripping hazards are a big thing, and we're likely to experience these where the flooring changes. So maybe the carpeting of our bedroom going into the tile of our bathroom. A rug on top of a rug should never exist. My mom loved rugs on top of rugs. I'm not sure why. Probably also the same because my grandmother put plastic on everything, right? You want to keep it nice. So I'm thinking that, but it really greatly increases your chance of tripping and falling. Rugs, especially on surfaces like in the bathroom or, next to the stove or the sink in the kitchen, if they don't have a really good rubber backing that holds them in place. And then also the thicker they are or the taller they are, that's a gap that our brains have to remember to lift our feet up higher than normal when we're walking, again, giving us the potential of some kind of a tripping hazard. So just thinking about your home, think about, do you have adequate lighting in the middle of the night to go safely from your bed to the bathroom and back? One thing that we suggest is, considering night lights and other things. But thinking about installing grab bars, we strongly recommend against using the suction cup grab bars because they just can't hold your weight. Now, if you look here at this middle picture, you will see a grab bar right next to a towel rack. Towel racks are meant to hold towels, not people. But if we don't have something that we normally grab, if we start to fall, we start to grab at anything we think will help us. But in fact, what ends up happening is we can get more injured. So consider where a grab bar might be helpful in making a transition, usually upstairs, in and out of doorways, and certainly in the bathroom. These should be professionally installed into the framing of the wall and not simply, a couple of screws into the wall or certainly not a suction cup. Think about where your lighting you have needs for increased lighting. And usually motion activated night lights are really helpful at night. They stay off. They let you sleep in the dark. I know a lot of people as we get older, we get more light sensitive. So we get up at night. The last thing I want to do is turn on the lights. My wife will be angry with me if I do. So we just installed some motion activated night lights, right? So it puts the light where I need it, which is at my feet to see what's going on, and they're not very expensive. Now, if I'm going to be traveling, and many of us do around the holidays, we go to our children's or grandchildren's or friends and families' homes. We are in a different environment, and many times these are also, back bedrooms or upstairs bedrooms or places, that don't necessarily aren't maybe sometimes aren't really used all that much. And so we need to think about what kind of light we need to have kind of to be safe and kind of suss that out a little bit and take a look. The other thing is that as we grow older, we lose contrast. I'm starting to develop cataracts. My vision is okay, but my eye doctor says that I'm probably going to need some cataract surgery probably in about 10 years. So cataracts, they start to give a little bit of film over what is supposed to be the clear spot through which we see light, right over our pupil. And as we get older, along with things like macular degeneration or wet AMD, we end up having degradation in our vision. And as we start to lose contrast, we have a difficulty in understanding depth perception, right? This is also obviously really important for us as we're driving, is kind of being able to see that, understand that. So adding contrast to stairs and to points where you have a transition, where maybe the sidewalk meets up with the driveway. Yeah, again, that's why it's helpful to just have that contrast. Um, we like to have our stuff near us, and so we have our lazy boy chairs, and we have a tendency to put clutter around them. The encouragement is to not put anything on the floor, but put it into something, and especially something that would be waist high or higher, because that keeps it within our visual field. Don't use throw rugs, or if you absolutely have to, make sure that they're double-sided tape, that they have an anti-skid bottom, and that when you step on it, it's not going to move. But remember, it's also higher than the other environment, and they become a tripping hazard. So rugs are generally not very good. We love our pets. It's important to have our pets, but 9 out of 10 pet-related fall injuries are associated with dogs. Cats are smart. They've got 9 lives and they get out of the way. But a lot of times, our dogs, and these occur for things like, having pet toys on the ground, training pets. We need to, one of the greatest risks for us is that when we're taking our dog on a walk, or probably sometimes more accurately, our dog is taking us on a walk, and they see a squirrel, um, we have to learn that it's okay to let go of the pet more than allowing them to pull us to the ground. So um, when we're young and strong and our pet pulls against us, we pull back and we're fine. But we get older, we have a little bit of a balance issue. Now our pet pulls us forward, and as they pull us forward, we fall. So something very simple, but never put the leash around your wrist. Only hold it in your hands. And when you hold it in your hands, if your pet pulls, it will pull the leash from your hand and not pull you off your balance and make you fall. So these are just some things to consider. The other thing to consider is that if for some reason we're ill or recovering at home, we might want to have somebody take care of our pet for us, because they need to be walked. They need safety and security. And although they want to be right near us, and sometimes that could be underfoot. So just think about that. When we're traveling, checking out our pathways and exits, bring a night light. Make sure that you got some good shoes that you can wear inside the house, as well as outside, because in bare feet and in feet that just have socks on them are some of the greatest risks for tripping. So, and I don't know about you, but I don't wear shoes to bed. So I really don't like, so what I need to do is just have a pair of slippers that I can slip into, that are fully, will cover my feet front and back and have a good grippy surface on the bottom. That will allow me to safely get to and from the restroom. Um, for some with a lot of urinary incontinence or issues, you might want to, consider maybe something like a urinal or incontinence items, because one of the greatest risks for folks is all of a sudden we wake up in the middle of the night, we have to go to the restroom, and we hurry and get up out of bed too fast, and as a result, we fall. So, big thing is what are your limits? Slow down. Careful how much you're multitasking. Be very cautious in new environments. Listen to the little voice in your head. You're like, ooh, I love visiting my kids, but I'm also worried about the clutter that is on the kids' floor, right? So, just say things like, I love being with you guys, but I'm really worried about falling if there's too much clutter on the floor. And they take 5 minutes and they clean up the clutter. Could be really important. Um, Learning how to fall is really important as well. Gravity's everywhere and it's out to get us, right? Never fall from a standing position. If you feel like you're falling, start to crumple up, right? And you want to protect your head. Land on your meat, your butt, your back, your thighs, probably not your back as far as your spine goes, but try not to land on outstretched arms. Try not to land on your hip. And certainly don't land where your head is going to be hit, especially if you're on blood thinners. Because if you're on blood thinners and you fall and hit your head, you're at great risk for head bleeds, stroke, and other things. Some basic things, keeping a cell phone with you or near you. You can always yell out to your phone to call for help if necessary. Maybe a medical alert device if you think you need to. But most importantly, think about what you're going to do in certain situations. Are people checking on you regularly? Do you have the ability to voice to an Alexa device or your cell phone to request help if needed if you actually don't have your phone with you? Remember that your eyes, ears, feet, and muscles all connect with your brain, and these are the ingredients of good balance. We have to have a good solid brain. We have to be able to see what's happening. Our ears have to be able to help us with our balance. Our feet have to be solid in where we're walking, and our muscles have to be strong and pliable enough. So what should we do? Have our eyes checked regularly, keep our glasses clean, consider sunglasses if we're going to reduce the glare, and work with your doctor around issues like glaucoma and cataracts and those kinds of things. Um, Sometimes it literally just having something to clean our glasses with is really helpful. Be careful if you have multifocal lenses. I do. I have those kind of transition lenses where the lower part is for reading, the middle part is for seeing at a computer, and the distance is up top. But when you go downstairs, you can have a disorientation to what's going on. So just, be considerate of that, consider that it could be happen. Remember that your ears are really important for your balance, and so is your hearing. Vertigo is treatable. Hearing aids are available, and you can usually get hearing evaluations done through your primary care physician. They can refer you to an audiologist. Also, I heard that Costco's have a free hearing exam that they will do for you. Um, think about your feet, what you're wearing. We go barefoot or only socks, or we have the pink fluffy slippers with the open back. But think about good fitting shoes, something that works inside of the house. So one thing that's really helpful is something that you can kind of slip into that's going to give you, kind of a solid sole at the bottom. And then if you have pain or sensation issues like diabetic neuropathy, those kinds of things, talk to your doctor about how to potentially treat those. Because if you start to have numbness in your feet, you want to walk less. That lessening walk decreases your gait, et cetera, et cetera. And basic exercise is really helpful. And this does not mean that you have to go sign up to do weighted exercise at the local gym. This just means that every day you need to get up and move. Um, Generally, we say 150 minutes of exercise a week. So 150 divided by 7, it's not a whole lot, right? It's way less than an hour a day, right? It's, a little over, 2 hours of exercise throughout the whole day. So, you do 15, 20 minutes a day, you're there. And if we don't move, calcium, even if we have a good calcium intake, it doesn't get into our bones. We need to move our bones and muscles for calcium to get in. So maybe you have difficulty in walking. Can you stand behind a really solid chair and literally just stomp your feet for 5, 10 minutes a day? The the research shows us that that's actually enough exercise to help keep your hips solid, right? Again, just getting up and moving and stomping your feet puts that uh, force into your hips and it keeps your hip bones strong. If you don't stress it, it doesn't strengthen. If you don't stress it, it doesn't strengthen. So if you don't stress your muscles and your bones, your muscles and bones won't be won't strain. Think about also a Tai Chi. Think about water aerobics. Our communities are filled with, YMCA's and Willamette Lane and senior resources, all sorts of stuff to help just get us up and moving. We don't have to spend a lot of money. We can just consider that there are, things that are out there. And then certainly, talk with your various caregivers about areas that you might get some additional help. Now, a great resource for you is right here in Oregon. It's called the Oregon Research Institute. It's actually not far from our hospital here in Springfield, Oregon. And the Oregon Research Institute is a professional, scientific, and federally funded research organization that looks at how to decrease the risk of falls and how to help people if they fall. And you can go on their website at ori.org, and you can contact them and say that you're 65 or older and you're interested in their Tai Chi classes, and they offer them online, either live, online, a couple times a week. They greatly reduce your risk of falling. Things like Tai Chi, dancing, and some other things strengthen and increase your ability for your brain to keep you balanced. And it reduces not only your risk of falling, but it reduces depression, anxiety, arthritis, a lot of the side effects of Parkinson's, and a lot of other conditions, right? Again, getting your body up and moving, super important. Another area that you might want to consider is what medications are you taking? If you're taking anything that kind of slows things down, like pain medication or nausea medicine, the big one is over-the-counter things for allergies like Benadryl, or if you take any kind of PM products, usually that PM product is whatever the product is with the addition of Benadryl. Benadryl makes you tired and sleepy. And also certain anxiety and antidepressant, bladder pills, and certainly any sleep aids like Ambien or Lunesta or Sonata. Those medications greatly increase your risk. Also, alcohol, because it makes your liver not get rid of your medications as quickly as possible. So, talk to your care provider. Can you possibly get a medication that still helps you with your blood pressure but doesn't give you dizziness? Maybe something that helps your allergies but doesn't, fog your memory. So, not using something like Benadryl, but using one of those medications like Zyrtec, for example. And then being willing to talk with your healthcare providers about your concern about falls, your risks, about your medications. Keep track of your falls, or better yet, even when you have those near misses. You stumbled, but you caught yourself, right? But one day you're going to stumble and not catch yourself. But try to figure out what are the things that might be putting you personally at risk. Talk with your primary care. Go see a pharmacist. They're really great to help you reconcile your medications. The other thing to consider is always get your medications at the same location, because if you do, then you have one pharmacist in one system, looking at all your medicines, and you're less likely to have medication interactions because they'll be able to find those medication interactions. Also, just realize that any behavioral health medications can make you sleepy, can also, especially if certain medications can really mess long term with your nervous system, and give you more, you lose the ability to have smooth muscle movements. There's a lot of stuff that's out there to help us to sleep. Couple things to suggest. Best habits for insomnia is to change your sleeping habits. Stay away from screens a couple hours before you're going to go to bed, because that blue light that comes from our handheld devices and our TV screens messes with our circadian rhythms. Be careful about what you eat and drink too close to bedtime. And if you need prescription medication, melatonin is the only safe sleep medication, across the board. But not getting good sleep gives you just as much of a risk. So just simply consider, if you need a sleep aid, work with your primary care provider about what is going to be the safest thing that could work for you. A couple of things if you have difficulty with urinary incontinence. elevate your legs an hour before you go to bed. This gets some of that extra fluid up into your abdomen and your kidneys, kind of get rid of it sooner. It's a way to decrease you having to go to the bathroom multiple times during the night. Certainly urinating before you go into the bed, limit your fluids. Um, and pelvic floor therapy is a way for you to work with a therapist to strengthen the muscles in the floor of your pelvis, decreasing incontinence. Think about your tripping hazards on the way to the bathroom and your lighting. Stay away from alcohol and caffeine. Both of those increase your kidney function. Be careful about large meals and things that are going to be spicy or acidic because of the kind of reflux and heartburn kinds of things. And don't ignore insomnia or daytime drowsiness because that puts you at risk. So think about maybe stopping unnecessary medications, switching to something that might be safer, or talk with your primary care provider about potentially even reducing the amount of medication. Sometimes they put you on 20 milligrams of something because everybody goes on 20 milligrams, but 10 might be effective for you. I'm not going to know, you're not going to know, but work with your care providers. Be careful about your alcohol consumption. Alcohol, your liver has to process it out. As we get older, our liver doesn't do as good of a job, even when we have healthy livers. So just be careful of that. Make sure that you're keeping your blood sugars in check, and realize that we are chronically dehydrated. If your urine is not a light yellow color, you're not drinking enough clear fluids during the day. So increase your water intake while you decrease your alcohol intake. And then if anybody here is on blood pressure medication, again, dehydration plus blood pressure issues can really drop your blood pressure. So be careful when you're changing positions slowly, when you're getting up from a lying position to a sitting position to a standing position, all really important. And then if you're on blood thinners and you fall, you're at a greater risk of permanent injury. So certainly keep up with taking your medications like your Eliquis or Saveza, but realize that if you hit your head, you probably need to seek medical attention to get a CAT scan. The last thing that you want to do is hit your head and think everything is fine, but you can have a little bit of bleeding in your brain that just kind of builds up over days. And so just be very careful of that. And then, of course, osteoporosis. We know that it is predominant, that it is out there, but a way that we combat it is with vitamin D and calcium. Vitamin D potentiates calcium and absorption into the bone, and the you don't have any signs or symptoms of osteoporosis until you break something. And the last thing you want to do is know that you've got osteoporosis with a fractured hip, right? So increase your vitamin D and calcium intakes. Make sure that you're stressing your bones through basic exercise on a regular basis. And if you're not sure, especially if you're a post-menopausal woman or you have in any way any digestive issues, you want to talk with your care provider about getting some kind of assessment for potential osteoporosis. So vitamin D and calcium, you don't need a ton of vitamin D or calcium. Generally, a multivitamin will give you everything that you need with a fairly decent dietary intake. However, consider talking with your primary provider about maybe additionally supplementing vitamin D and calcium beyond a normal everyday vitamin and normal dietary intake. Um, you don't have to have thousands and thousands of units of vitamin D. Again, usually I think it's like 2,000 units is what is in a standard multivitamin, and that's really going to be enough, along with milk and being out in the sun every once in a while. And then, of course, calcium. The other thing is that calcium is helpful. It helps to get into your system with the addition of vitamin D and vitamin C. So if you take a good multivitamin that has vitamin C, vitamin D, and some calcium in it, you're probably going to have yourself covered pretty well. And then you want to be realistic and you want to do some assessment. Look and see, stay on your feet. Are you at risk? What is your risk? And then what do you maybe need to do about it? These are things that you have to kind of answer for yourself, right? But you have to have a game plan. If you don't do anything about it, you're choosing to allow this to become your reality. Um, so if you do something about it, have your medication reviewed, get your eye, ear, hearing, and eyes checked, get rid of the clutter in your home and your loose rugs, do some kind of exercise for muscle movement and balance, and have some safe footwear, you greatly reduce the risk of having a really serious event if you fall. So that's kind of the end of what I have to present to you. I guess my suggestion to everyone would simply be, um, don't think it can't happen to you, because it can. It happens to all of us. And so the question is, what do we want to do about it? Especially if we know that we're at greater risk because of ALS, Parkinson's, problems with our hearing and vision, sometimes all of the above. Um, we don't want to become part of that statistic. We want to be able to kind of be like my father-in-law was, had Parkinson's all the way into his 80s, died with it, not from it. And he realized that he needed to manage his Parkinson's through his medications, but mostly staying active and staying connected with his community and family really made a difference for him. And I know that it can make a difference for you. Would be glad to take your questions.
Okay. Thank you so much, Jim, for that presentation. And um, see here. We go. That was a lot of really fantastic information about fall prevention. I got a lot of ideas. I have my flashlight with me. I'll have to remember to think about taking that with me if I'm at a hotel or if I'm visiting someone else. Make sure I have that available.
One thing
And
that's also helpful there
yeah,
is a headlamp. A headlamp
oh,
is a way it puts the light where you're looking, and it keeps your hands free, especially if you're going to be walking outside or on uneven ground. Consider a headlamp. You can get them at really any Walmart or REI or any of those places, and they're pretty cheap.
that's a great idea. Thanks for that, Jim. The other thing that I wanted to bring up that I thought of when you were speaking and making recommendations about, like, if you're thinking about grab bars or something like that, is that we just had a program recently that we recorded that was about home renovations. So this program is recorded, and you can also find a recent recording of our house that talks about thinking about making home renovations. So I wanted to thank you for your presentation and also let everyone know Parkinson's Resources of Oregon, we are here for you. And you can follow up with us, call our helpline, or send us an email if you want to know about our other educational programs and services, or to find local resources. That's what we're here to do. And I hope that I'm also going to see people at our soul support walks.